Hi everyone, welcome to PharmaGrid. So today we are going to continue with the patient profile based clinically oriented type of questions. So starting with the first question, a 52-year-old woman with multiple endocrine neoplasia syndromes has a large pancreatic tumor and bilateral adrenal tumors. She is hospitalized on the medicine service. The tumor is considered inoperable. Her blood pressure is 180/100 mmHg. In addition to intravenous fluids, this patient may benefit from which of the following interventions? So here the options are analgesics through the oral route, then analgesics through the transdermal route, then phenoxybenzamide intravenous route, phentolamine intravenous route, then tolterodine oral route. So here we need to find out the additional intervention that the patient may get benefit. So here the answer is option C, that is phenoxybenzamide through the intravenous route. Phenoxybenzamide is used in the treatment of pheochromocytoma. So what is this pheochromocytoma? It is a kind of tumor, a catecholamine secreting tumor of cells derived from the adrenal medulla. So this phenoxybenzamide can be used as a treatment option for pheochromocytoma. Prior to surgical removal of the tumor, patients are treated with phenoxybenzamide to preclude the hypertensive crisis that can result from manipulation of the tissue. This drug is also useful in the chronic management of these tumors, particularly when the catecholamine secreting cells are diffuse and therefore inoperable. This medication should be given through the intravenous route. Then let's see why the remaining options are wrong. This patient should have immediate treatment of her hypertension. So analgesics should be of no use in this particular condition. Then option B, that is transdermal administration, is not the preferred method of administration in this patient. Then option D, which is phentolamine. Phentolamine is the preferred agent for short-term treatment of pheochromocytoma. Then option E, which is tolterodine, it is indicated in men with benign prostatic hyperplasia. Next one, a 59-year-old man with decreased urinary stream and hypertension is prescribed doxazosine in hopes that both problems will be treated. Doxazosine is an alpha blocker. He begins dose escalation with 1 mg given for 1 week, 2 mg given for 2 weeks, and 4 mg given for maintenance. This particular patient returns to his primary care physician saying that this medication is not helping. To determine whether or not the patient is taking the medication, it would be useful to look at the excreted concentration of this medication, which means doxazosine, in which of the following areas. The options are blood, feces, liver hepatocyte extract, skin, urine. Here the correct answer is option B, that is feces. So metabolism usually occurs in the liver. So this metabolism leads to inactive products that are excreted in urine except for those of doxazosine, because for doxazosine the major route of excretion through the feces. Okay, so here it would be useful to look at the excreted concentration of doxazosine in feces. Doxazosine is the longest acting of these drugs used to treat benign prostatic hyperplasia. Doxazosine has added benefit in that it can also treat mild hypertension. So the point to be kept in mind is that doxazosine is mainly excreted through the fecal route. Question number 28. A 19-year-old pregnant, that is G1P0, woman lost her eyeglasses for a day. Constant squinting causes her to develop a headache for which she takes ibuprofen. Which of the following poses the greatest risk to her fetus? Okay, so here we need to find out whether here this patient is pregnant. Okay, here this patient is pregnant, and here we need to find out what will happen if the patient takes ibuprofen, which is a non-steroidal anti-inflammatory drug, and what is the risk to her fetus. The options are acute tubular necrosis, decreased pulmonary surfactant at birth, loss of physiologic heart shunt, low birth weight, no risk. Ibuprofen is a safe drug for pregnancy. Here the correct answer is option C. There will be loss of physiologic heart shunt if the patient, especially if the pregnant patient, takes ibuprofen. We know that this ibuprofen is a NSAID, that is non-steroidal anti-inflammatory drug, which inhibits cyclooxygenase enzymes to block the prostaglandin synthesis. This is useful for mild pain management because prostaglandins are pain sensitizers and cause inflammation. So this ibuprofen is a NSAID, and its mechanism of action is by inhibiting the cyclooxygenase enzyme and thereby decreasing the synthesis of prostaglandins. But prostaglandins serve other functions as well. one of which is to maintain a patent ductus arteriosus in the fetus, one of the main function of prostaglandin. Or we know that there are different types of prostaglandin analogs. Okay, that is PGE1 analogs, PGF2 alpha analogs, like that. And one of the function of this prostaglandin is to maintain the patent ductus arteriosus in the fetus. NSAIDs are contraindicated in pregnancy because they will inhibit the production of fetal prostaglandin E2, allowing this physiologic shunt to close prematurely. Now, let's see why the remaining options are wrong. Ibuprofen can cause acute tubular necrosis because of inhibition of vasodilatory prostaglandins, but this is more a concern for patients with underlying renal disease. Here the patient is pregnant, there is no history of renal disease. Now the next option, NSAIDs are not known to have a negative impact on pulmonary surfactant production. Then option D, NSAIDs are not known to lead to low birth weights. Option E is wrong because ibuprofen is contraindicated in pregnancy because of the risk of premature ductus arteriosus closure. Next one, a 63-year-old man with debilitating Parkinson's disease is currently taking levodopa. His primary care physician adds carbidopa to his treatment regimen. 1 week later, the patient presents to the emergency department complaining of anorexia, nausea, and vomiting. What is the most likely explanation for these findings? The options are drug toxicity, idiosyncratic drug reaction, stimulation of the chemoreceptor trigger zone, underlying infection, undiagnosed malignancy. Here, the correct answer is option C, that is, due to the stimulation of chemoreceptor trigger zone. One of the adverse effects of carbidopa is nausea and vomiting. Carbidopa is a peripheral decarboxylase inhibitor. This can occur because of stimulation of that is, this nausea and vomiting is mainly due to the stimulation of chemoreceptor trigger zone of the medulla. This is not a drug toxicity, nor is it an unexpected idiosyncratic drug reaction. Moving on to the next question. When treating patients with Parkinson's disease, there are three dopamine agonists, that is pramipexole, ropinirole, and rotigotine. Regarding the pharmacokinetics of these agents, which of the parameters might suggest favorable clinical efficacy for pramipexole? The options are bioavailability, half-life, hepatic excretion capability, volume of distribution. Here, the answer is option A, that is bioavailability. The pharmacokinetic properties of dopamine agonists, pramipexole, ropinirole, and rotigotine are evaluated in this question. Pramipexole has the highest percentage of bioavailability of the three agents, that is 90%. That is, the three agents means out of this pramipexole, ropinirole, and rotigotine, pramipexole has the highest bioavailability, that is 90%. Bioavailability means rate and extent of drug absorption. Now the option C, that is half-life. The half-lives are similar for all these three agents at approximately 6 to 8 hours. Then option C, all three agents are excreted via the kidney, not through the hepatic route. Then option D, that is rotigotine, has the largest volume of distribution but the lowest bioavailability, which is 45%. Okay, so here the favorable clinical efficacy profile for pramipexole is bioavailability. So with this question we have completed today's question discussion series. Thank you everyone. Please like, share and support. Have a good day.